Hi again, guys. Thank you for watching. Appreciate it. Today we're talking to a young lady by the name of Nicole, who has been in this industry now for about 2.5 years. She's a very interesting lady, and her short but interesting journey should inspire you. Anyway, hope you enjoy. Hey Nicole, thanks for agreeing to have a chat with me today, and tell us a little bit more about yourself and your journey in this interesting industry that we work in. How long have you been involved in the massage industry?
I graduated with my diploma in 2017, so I started pretty much from 2018 straight up the bat, quit my job in retail.
Okay, you're in
yeah.
Yeah, okay, I didn't realise that. I thought you'd been around the traps for a little while, so to speak.
Yeah, no, I just immersed myself into the whole thing, so which was my whole plan along. I'd been 10 years in the retail, and I knew I needed to get out, so the plan was study for the 12 months to do the course, take my long service leave, and I didn't look back from there.
Okay. So was there any specific incident or reason that you decided to study soft tissue therapy?
More like my interest personally, probably as well, due to various injuries and that sort of thing. Very interested in human anatomy, the way the body works. Ideally, I like the route of the kind of the physio, where they can look at your body mechanics and help you kind of strengthen or work out whatever's going on. At my age, I was like, I don't want to study for 4 or 5 years. So I was always getting treated by massage therapists myself anyways, and I really like the way that you can actually adapt the same qualities as the sort of physio assessment skills, especially if you keep yourself knowledgeable and make sure you learn. And I knew that I could definitely do some good and apply. So that's why remedial massage. I thought, look, you know what, that's a 12-month course, and I will still get to work in environments around the physios, around the sports, the athletes and that sort of thing.
Okay.
So that's why.
So a way of being involved in a sport or an activity, but at a slightly different capacity, or a different capacity, I should say. Yeah. Interesting. So did you study, without naming any names, in through a private RTO, or did you study through TAFE? Or
through the TAFE.
Through the TAFE system?
Yep.
Did you feel as though your training was adequate enough by the time you had graduated?
It was very condensed into 12 months. Like, to be honest, even all the teachers all the teachers are fantastic. However, even they said, we are loading you guys up with so much information and you're going to walk out of here with your head spinning. But over the time and the more I was practicing, it's all started yes, there's some things that you go, oh, I think I got shown how to do this now, I don't quite remember, but it starts coming back to you. It's like the use it or lose it kind of a deal with massage, and just give it a go.
The analogy that I often use when I'm talking to students or recent grads is that I liken it to me trying to make muffins, that I have to follow a recipe.
Yep.
And then I keep following that recipe, and eventually the recipe gets locked into the brain cells and it becomes second nature. The problem with the human body is the recipes don't always work, do they? But if you've got a basis on which to establish some format of working, it doesn't matter what that format is, that you're going through your assessments and whatever else, that you're always tipping something into your cup of knowledge. So do you work from home in a home-based clinic, or do you work in an external clinic with other professionals?
No, I work within a physiotherapy clinic, which was always my goal.
Yep.
Coming out of this, I didn't want to practice from home. Not that that's isolating, but I know that there's still so much more for me to learn, and being able to like literally knock on a physio's door and go, hey, I was just thinking this, what do you think? Or, you know, it's just really good. It just means the knowledge is always sort of getting shared. It's just a nice environment. Again, I like that whole community base.
And that's the thing, like we talked about the cup of knowledge in a situation like that. And there's nothing wrong with working by yourself in a home-based clinic or whatever. It has to be what works for you as an individual, as a therapist. But when you've got that ability to knock on the door and say, you know, he's presented with X, Y, and Z. I'm thinking it could be A, B, C. What are your thoughts? And then they'll go ask you a whole bunch of questions. Oh, you know, you might go, yeah, I've done that. Oh, I didn't think of that. Yeah, I forgot about that. How do you do a NIRS test again, or whatever it might be? Yeah. But you obviously enjoy working in that type of environment.
Yeah, I thrive on it. I really like it.
Good. How would you describe your massage? As in, with the variety of massage types, for want of a better word, you know, remedial sports, kahuna, relaxation, whatever. How would you describe your style of massage?
I'm definitely more remedial and sports. Like, you still have people that come in, want an all-over body treatment, nothing specific going on, but I still try and, you know, like seek out. I don't just do a flow as such. I will get in and cover their whole body because it's their treatment and if that's what they want, but I definitely specifically go looking, you know, like, here's some tension in here. Here's something here. So it's, it's not all candles and, you know, balancing of energies. It's very, very hands-on, very, very much about their specific human anatomy. So,
and there's nothing wrong with that other style of working if that's the way that you specifically work. Absolutely. That's why I've got that question in there, because I know lots of people who work in very different areas on many different levels. And they all work for different people. So you attract a client base who are comfortable with the way you work.
Yeah, and that's absolutely right. That's if you can find, you know, like, I'm not offended if, like, say, see a new client for the first time and maybe I'm not the massage therapist for them.
Yep.
Same as, I go and get massages as well. So it's that whole kind of what are their expectations and what's my treatment and how does they kind of marry up together.
Yeah. And you have that conversation with them, with new clients. You have that conversation with them in the beginning of the process anyway, so everybody is aware of what to expect and what the expectations are. Everybody is different. So what do you find the most interesting thing, or what gives you the most joy in what you do?
I really like it when people come, say, with that specific problem, and whether they're in, pain, or if it's stiffness or limited range, that they can, I can get in there, treat the area. And as I usually do that, I usually talk to them about where I'm treating, what that muscle is, what that muscle does. And then if they can at least get off my table, A, feeling a bit of relief, as well as B, having a little bit more awareness of why that's happening. And, like what maybe they, you then find that they might go, oh, actually, well, how can I change that? So then they're more open to be able to go, oh, well, let me just give you one or two simple things that you can maybe think about as a start. And we'll see, ongoing treatments, see how they're presenting each time they come in. So that's always really satisfying to have someone come in.
It's that educating your clients as to how to take more ownership of their ongoing problems or their current issue, whatever it might be.
Yeah, basically. And, you don't have to give them a million things to do.
No.
Just one or two simple things.
Yeah.
Even if it's just be a little bit more thoughtful about how you're sitting when you're sitting at the desk. That, there we go.
Yes. What do you find the most frustrating?
I wouldn't say anything's frustrating. I do just find I'm not as it's not as exciting for me if, I'm happy for the person, but if they come in and they're like, oh yeah, no issues, just a bit of all over, it'd be great. It's just like, oh, okay. I don't mind. Like, it's actually a nice way to switch my brain off sometimes, but it's more, if you get, say, a run of those appointments in a day, I can start being like, oh, come on, give me something to get my teeth into and
get the brain
try and
cells.
work out for you. Yeah.
Yep.
Yeah. So, but I mean, like that, if that's my frustration, that's tiny. At the end of the day, if that client gets off my table and I've delivered on what they wanted and they're feeling good, then I'm proud of that.
I think what you'll find just talking to you today and getting to know you a little bit more personally, that because you've only been in the industry for 2 years, 2.5 years,
Yeah.
or something? Yeah.
Yeah.
So as you fill your bucket of knowledge up and continually learn more assessment skills and treatment skills and all the rest of it, that you will attract more of those people who are looking for that, which will keep the brain stimulated. And you'll be going, I just want to do a relaxation massage where I can switch the brain off, because what I've found over the years happens is that you'll get somebody in with a specific issue, and you might get one of the physios, or in our situation here, the podiatrist in, and he might go, oh, no, I think that's this particular issue. So, and if it's out of our scope of practice, when you go home, you're onto Google Scholar, hopefully, looking up, what is that? What is cuneiform syndrome? How do we treat that? Is it any soft tissue imbalances that we can look at, or is it purely a biomechanical thing that needs to be addressed with manipulation or orthotics, or whatever the case might be? So even though you get that brain switch off with the client in the room, you find that you're double timing it when you go home later on that night, or if you've got a break through the day. That's what I find anyway, because you never stop learning in this industry. There's always something new that you didn't know, or that technology has improved to a point where what we thought was the gold measure of treatment even 5 years ago is now no longer the case, because we now know that this doesn't do what we used to say it did, if that makes sense.
Yeah.
So the learning process just is exponential. As allied health professionals, we have to gain continuing education units, or CPUs, whatever you want to call them. What do you prefer? How do you do yours? Face-to-face, online? Where do you find it?
I prefer face-to-face. I just get a little bit more stimulated. It's exciting, and it's hands-on, so you can, if you have to question something, you can question it right then and there.
Yeah. So
I do prefer that. However, having said that, as long as an online course is fairly straightforward to follow, I'm happy to work through that. To probably going to take advantage of some of the webinars that are available through the associations. So, but I do find I don't want to just do something just for the sake of getting points. I want to do something because it's of interest to me. It's relevant for what I do. So I'm involved with the Women's Soccer League. So if I can do something around specific athletes and that sort of thing, I'm just their sports trainer and sit on the sideline, but hey, if I can benefit them.
No, I'll stop you there. You're not just their sports trainer. You are their sports trainer.
True.
Yes.
I am.
Yeah.
Yeah.
Don't sell yourself short.
Oh no, like I'm quite proud to be able to say that there's some of the reasons that some of the girls might have a ripper of a game, especially if I've had to treat them or tape them or do something with them before the game. I can be like, you know what, I've contributed to that performance because she's supported, she's feeling great, and look at her go out there.
Do they show their appreciation to you?
Oh God, yeah, they do.
Oh, good.
Yeah.
Good.
Yeah, no, they do. I feel like literally feel like a member of the club.
Good, yeah.
And I am. So.
And that's what will keep you there and keep that enthusiasm.
Yeah.
I found personally when I was working with rugby league teams, you're just the rubber.
Mm.
And when I started working with hockey, it was a totally different mindset. You are part of the team. You are invited to all the team events. You are invited to all the successes. You're also there for all the failures. But you are part of the team, and that really does make you appreciate what you do for the players, because they come back and show you they appreciate what you do as well. Yeah.
Oh, look, they're lovely. They even, if I have to miss a game, I've got all 4 grades of women, like from the ages of 12 up to the first graders, and if I have to miss a weekend for whatever reason, the next time I go, they're like, "We missed you." So it's lovely. Yeah, it's nice to be part of that that community club. Yeah, it's a great day out. I get to sit on the sidelines, watch some footy, chat to people,
and hopefully get paid to do it.
Oh yeah, we get paid.
Thanks very much for being part of this and allowing me to video this and get it up, and I know we will talk again in the future. And don't forget, we will come through this and we will see you all on the other side. Stay safe, stay healthy. Thank you.